Morning, everybody. It's Congressman Jamie Raskin from Maryland's beautiful 8th Congressional District. We're coming at you today from the Rayburn House Office building. Welcome to our 9th annual Federal Employees Health Benefits Forum. The federal benefits open season for 2025 is November 10 through December the 8th, 2025. So the open season is rolling now. We've got a panel of phenomenal experts this year. As always, but before I begin, I wanted to share a few updates of relevance to the federal workforce. You know, I'm proud to represent more than 50,000 federal workers and retirees who live in Maryland's 8th District. And I need to acknowledge that the Trump administration has been waging an all-out offensive against the federal workforce and its ability to deliver results and policy for the American people with sweeping executive actions that are both destructive and often illegal. President Trump has fired tens of thousands of career public servants, unilaterally canceled critical federal contracts, and frozen federal government funding in a number of our key departments. And to make things worse, even federal workers have gone without pay for more than 40 days during the government shutdown. So I'm fighting every day to protect our federal workers and federal contractors and to restore the safety and integrity of the professional civil service workforce and the rights and benefits of the people who are in it. As the lead Democrat on the House Judiciary Committee, I'm fully dedicated to protecting and advocating for our nation's public servants and for the federal retirees. Turning now to the pre-planned topics for the day, starting with the basics on federal pay for next year. In August, President Trump proposed an average 1% pay increase for federal employees in 2026 and froze locality pay, meaning there will be no adjustment to pay based on regional cost of living differences for most workers. Law enforcement will also receive an additional increase of 2.8%. This falls well short of increases that President Biden implemented in 2023, 2024, and 2025. Please know that I will keep fighting hard every day for better pay and benefits for our dedicated federal workforce. Turning now to retiree COLAs, as I'm sure many of you are well aware, in 2026, there will be a 2.8% cost of living adjustment for federal retirees under the civil service retirement system and a 2% increase for federal retirees who are under the FERS program or the Federal Employee Retirement System program. I'm a co-sponsor and champion of the Equal COLA Act, which would fix this unfair two-tiered system and ensure that FERS retirees get the same cost of living adjustments as other retired federal workers do. Once again, in the years ahead, I'll be doing everything I can to protect and to empower our federal workers and retirees. All right, let's begin our forum. We've got a fantastic group of experts for today's panel, and they are ready to discuss the various federal employee health benefit plans and other options that are available to you. Each speaker has been asked to speak for 5 to 7 minutes. The program should end by 1:45 p.m. at the latest. I want to welcome first Tammy Flanagan, who serves as a benefits expert for the National Active and Retired Federal Employees Association, for NARF. Tammy has spent 30 years helping federal employees take charge of their retirement by understanding their benefits. She provides individual counseling as well as online training for NARF, Plan Your Federal Retirement, and the Federal Long-Term Care Insurance Program. Tammy, thank you for always being such a great participant here. Welcome, and the floor is yours.
Thank you so much, Congressman Raskin, and thank you on behalf of all the federal employees, because they definitely needed your help this year. It was a year like none other, for sure. So we're on the topic of our open season, which has been really big on my mind this whole time, because we get a lot of calls at NARF, and also in my own practice, I have a little consulting business, and boy, there's been a lot of questions around the National Association of Letter Carriers plan leaving FEHB. It is still available for the postal workers and the postal annuitants, but not for the regular federal employees' health benefits group. So those employees have had a lot of questions about what to do, because if you're like any other federal employee, you probably haven't changed plans in maybe the last 20 or 30 years. Federal employees tend to stay in the same plan. They might take a glance at these plans, see how their premiums are looking for next year. But when it comes time where they have to make a decision, it's kind of tough because it's paralysis by too much analysis. And I know Kevin's going to talk about how to get around that by using some of the tools that are available that can really help with that. But that's been the one thing. And then the other thing that's always a big topic around open season and throughout the year is when someone retires who's already 65 years old, and we had a lot of people retiring this year, those people have a question about what to do about Medicare. Because under the Federal Employees Health Benefit Program, you have the choice. You can have Part A of Medicare, which you've already paid for, but you don't necessarily have to enroll in Part B. And for next year, the standard premium for Part B is $202.90 a month per person. So if you're part of a married couple and you're both 65 or older, that's over $404 a month. So that can be an extra premium that you're not sure whether or not that's worth paying. So that's another big question I get a lot of response on and a lot of concerns about that. I will tell employees that having Part B and Part A of Medicare is a really good combination with most of your FEHB plans. What I would suggest is that if you're in that situation where you're in the point of having to decide whether or not to enroll in Part B, look for a federal health plan that gives you some incentives to enroll. Since you don't have to, and since Medicare becomes your primary insurance after retirement, it would stand to reason that the federal health plans would love it if you did enroll, because then Medicare takes over most of the bill. So there are some plans such as Blue Cross Basic that'll rebate you at $800 a year per spouse on that Part B premium. Aetna Direct gives you back $900 a year per spouse. And those two plans are pretty reasonably priced, and they waive your cost sharing, your copays, your deductible if there is one, and any co-insurance when Medicare pays first. Now, another plan that also gives you a rebate is the GEHA high option plan. They give you $1,000. However, in most years, that's been a really good alternative to use with Medicare. But this coming year, if you're in that plan, those premiums are going up quite a bit. I'm just looking at the rates for the Self Plus One option, and the increase, this isn't the premium, this is the increase next year, is $271.98 a month. And if you're in the self-only plan, it's going up over $126 a month. So if you're in that plan, you might want to take a look at the standard option instead of the high option, because it's going to give you most of the same benefits for a lot lower price. There's no rebate, but it's a lot less expensive plan. So, unless you need a lot of prescription drugs, that might be a good alternative. So there are plans that work well with Medicare. Those aren't the only ones, because we have a number of HMOs like United Healthcare and Care First Blue Choice that also work well with Medicare Part A and Part B as well. Now, the other thing I'm getting questions on, because this is now becoming standard issue with federal health plans, is that Part C, which is Medicare Advantage plans, have now become available in almost every federal health plan, with the exception of Blue Cross Basic and Blue Cross Standard and Focus. But all the other plans have this option where if Medicare is your primary insurance, you can enroll in Part C, and that becomes your coverage. You still have to have A and B. A lot of people think they can get out of Part B if they pick up this Medicare Advantage option, but a requirement of that is to have Part B as well as Part A to have Part C. So we're getting up to A, B, C, and D. Now, the Advantage plans are a little different than using Medicare as primary, because now the company, whether it's Aetna or Cigna or United Healthcare, that becomes the insurance. So you always have to make sure that your providers will bill that plan and accept a Medicare Advantage plan. And some providers have dropped out of that scene, so you really want to be careful that that's not going to happen and you'll have to change providers. I know with my husband's doctor, they said they're no longer taking the Aetna Advantage plans. So fortunately, we're not in that plan, but if we were, we'd have to definitely make a change. So the Advantage plans give you the advantage of no out-of-pocket expenses, plus some additional perks, typically a gym membership for free, meal delivery when you come out of the hospital so you don't have to cook, or if you're the caregiver, you'll get out of that job for the next 2 weeks, and also some transportation to non-emergency doctor visits. Those are the typical perks with these Advantage plans, as well as a reduction in your Part B premium. This isn't just a rebate where they send it to you in the mail. This is when you look at your Social Security check, that premium goes down maybe $75 a month, some cases more. Some are $100 or even $125, and a few of them are even more than that. So those can be an attractive option and certainly more cost effective, but you just got to make sure that you have the providers in that plan that will accept that plan. So that's another thing to be aware of. And then lastly is the Part D. That's the Medicare drug benefit. And OPM has made it clear that all the federal plans are to adopt a Part D plan, and most of them have. So if you have Medicare A or Medicare B, you can have the Part D, and usually that's automatic. And those benefits include a limit on how much you'll pay out of pocket for your prescription drugs, and also lower copays. So the copays can be less than in the standard drug benefit of that underlying plan. Now, beware though, if you're a postal retiree who has to be in Medicare Part B, you also have to be in Part D to keep that postal health plan. So even though you can drop the Part D drug benefit, if you're a postal retiree and you choose to do that, beware that you have no prescription drug coverage whatsoever through your postal health benefit plan. So you'll be out looking on the marketplace for a drug benefit that you have to pay a premium for. So I would not recommend that our postal retirees get out of the Part D if they're in it, because they'll lose that drug coverage. But for FEHB members, if you're in the IRMA category where you're paying extra because you're higher income, that's a good thing. But the bad thing is they have to pay higher premiums for both Medicare B as well as Medicare D. So if you're not filling a lot of drugs or brand name prescriptions, then you might want to drop that Part D plan, because if you're paying an extra, $40 a month or whatever it is for the IRMA surcharge, that might not be worth it to you. So you can go back to the underlying federal health plan's prescription drug benefit. So there you have it, A, B, C, and D of Medicare, and those do work really well with many of the federal health plans. So definitely something to take a look at.
Thank you, Tammy. That was just terrific. I'm grateful to you for elucidating those different options and subtleties of different pathways for our people. Next, I am proud to welcome Kevin Moss from Washington Consumers Checkbook's Guide to Health Plans for Federal Employees. He's worked for Consumers Checkbook for over 25 years, where he leads production of their guide to health plans for federal employees. He regularly shares his expertise as a contributor to GovExec, FedSmith, Federal Times, and the Federal News Network. He also holds dozens of webinars throughout the year to provide advice on choosing a good FEHB plan. Before I turn it over to you, Kevin, I just want to say we did invite OPM to come to be represented, as they did do in prior years in the Biden administration. Unfortunately, they did not respond to us. And so that's why OPM is not here with us this year. But I turn it over to Kevin Moss from Consumers Checkbook.
Thank you so much, Congressman. It's always great.
Kevin, forgive me, I'm going to have to excuse myself. I've got to go to the floor, but you're in good hands with Maria and Kathleen.
All right. Good luck. Thank you, Congressman. And it's always great to be here talking to constituents from Maryland 8th. Tammy did a great job of walking you through Medicare and what annuitants should be thinking about. I'll have a couple of things to say at the end, just to fill in a few things that I think are important, but mostly we'll talk about active federal employees. And some of what I will say today obviously applies to annuitants as well. And so one of the big stories is just what's happening overall with premiums and how much premiums are going to cost next year. And it's not great news, because the average enrollee share of premium is increasing next year, if you haven't heard. It's a little bit better than this year. This year we were at 13.5% average enrollee share. This year it's a little less than that. but it's still double digits. It's 12.3% on the average enrollee share. And when OPM released information for the 2026 plan year, they talked about greater utilization of prescription drugs, particularly the GLP-1 weight loss drugs, as one of the contributing factors towards these higher premiums. They also talked about a higher average age of a federal worker compared to a similar worker in the private sector as some of the explanation of why these premiums are going up. But do keep in mind that not all of the FEHB premiums move at the same rate or at the same velocity. There are plans next year that are actually decreasing the premium. There's plans that are increasing below the average, and there are some plans who are actually increasing above the average. The place that I like to go to see what's happening with premiums, it's a very important document, and it's the official FEHB plan brochure. If you go to the very last page of any FEHB plan brochure, you will see a premium table that shows you for self plus one, self and family enrollment, how much the government's paying towards your premium, how much you're paying. It's where you can see how much you'll be paying next year. And while you're there, make sure that you hit section 2 of the official FEHB plan brochure. This is the section that will tell you how else your plan may be changing next year in terms of the benefits that it offers. And one trend that I've been seeing this year is that there's actually 29 FEHB plans where the catastrophic limit is increasing next year. This means that your risk of a worst case year in terms of how much you would pay out of pocket is going to be a little bit higher if you're in one of those 29 plans. But this is where the plan will talk about whether there are benefit changes. Most of the time, it's about this benefit's going to cost you more next year, although sometimes you can find new benefits. And one area of good news for federal employees next year is that there will be a record number of FEHB plans that cover in vitro fertilization or IVF. OPM now mandates that FEHB carriers that operate an HMO in a state that mandates IVF must carry that IVF coverage into their FEHB plan. And I know this is an issue that has been important to a lot of federal employees. And next year, there will be a record number of plans covering IVF. In Maryland, local Aetna and United Healthcare plans will now have IVF coverage, and they join plans offered by Kaiser and Care First in the Maryland area. And then there's also 2 nationwide PPO plans that have IVF benefits that are open for everyone to enroll in, and that's GEHA High and Blue Cross Blue Shield Standard. And if you're eligible to enroll in the Foreign Service Benefit Plan, you can also find IVF coverage in Foreign Service Benefit Plan. Now, one other thing that can change from one year to the next, and this is also an important local story, is providers. And the story in Maryland has been United Healthcare and Johns Hopkins falling out of agreement. And right now, and this could change, but right now, there isn't an agreement between United Healthcare and Johns Hopkins, and now means that FEHB plans, both those offered by United Healthcare or plans that use a United Healthcare network, Johns Hopkins providers will be out of network. And this could impact you in terms of the access to providers that you have. It could also impact you in terms of your out-of-pocket costs that you'll have to pay. It's always more expensive to go out of network versus in network. So checking on your providers is part of that list of the homework activities that I think every federal employee needs to go through. And the carrier websites have a provider search feature where you can enter your provider name and see if they'll be in network next year. The other thing to check while you're on the carrier site, look for new prescription drug costing tools. OPM is now asking all carriers to provide a prescription drug costing tool where you can put in your medication, the dosage, what pharmacy you'd like to go to, and you will get both an answer as to whether your prescription drug will be covered and how much you will pay for it out of pocket. Year to year, there can be changes in terms of what drugs are covered, and how those drugs will be classified on tiers, and if sometimes these changes can produce higher out-of-pocket costs from one year to the next. So this is another area where you will want to check just to make sure that everything is okay with your current plan, or if you're considering a new plan, make sure that you're checking those two things to see how your new plan will cover either your provider or prescription drug. As Tammy mentioned, NALC leaving FEHB has been a big story. This impacts about 28,000 federal employees and annuitants around the country. Most of those 28,000 were on NALC high. Very important that you are making a positive election into the plan that's the best fit for you next year. Now, OPM will not leave you without a health plan. If your plan is leaving and you are enrolled in NALC, they will enroll you in the default plan, but this is also rather interesting next year that OPM has chosen a default enrollment plan that, as far as I know, this is the first time that OPM has not chosen the lowest cost nationwide plan that doesn't charge a membership fee and is not a high deductible health plan. They have the option to choose any plan that they think is the best fit for plan members that are losing their plan. And next year they have chosen GEHA High. And as Tammy has mentioned, while that plan is up for consideration for folks who are losing NALC High, do keep in mind that the premiums are higher than NALC's High premiums were this year. And there's other plans, of course, that are available that may offer you more value. Plans like maybe GHA Standard or Blue Cross Basic, maybe even Compass Rose High. And if you want to keep the Cigna provider network, you may want to think about Samba Standard. Active employees, I think saving money is something that everyone should be interested in. And active employees, I think, have some tax preferred ways of paying for out-of-pocket healthcare expenses that are worth exploring. High deductible health plans, I think, are a plan that does deliver low cost. And when you're an active federal employee, you get a health savings account, and the plan makes a contribution into that health savings account. You can, if you want, decide to make voluntary contributions that are triple tax advantaged. They go into the account tax-free, they grow tax-free, and you can take them out of health. You can withdraw those funds for qualified healthcare expenses tax-free as well. These plans do tend to have lower costs because of that plan contribution, but do keep in mind that there's probably a little bit more risk of higher out-of-pocket costs. If you were unlucky at the beginning of the year before you met the deductible and you had an unexpected hospitalization, you may face higher out-of-pocket costs in a plan like a high deductible health plan than some of the PPO plans. But one other type of savings account that's worth considering that is no risk is the flexible spending account. I think all active federal employees probably have some amount of predictable out-of-pocket healthcare expenses, both for their medical needs or dental or vision or a lot of over-the-counter pharmacy items, where if they set up the flexible spending account, you get the same tax benefit of paying or contributing to that account pre-tax. This produces about a 30% savings of what you pay for out of pocket. This is, in the era of high premiums, a guaranteed way to save money on some of your healthcare expenses next year. The contribution limit is rising slightly. It's going up to $3,400 next year. And remember, this program really is only available to you while you're working. Once you retire on an annuity, you no longer qualify for the FSA. Go to fsafeds.gov to learn more, and it shares the same open season dates as FEHB through December 8th. Tammy went through a lot of the stuff with annuitants. I just have a couple of additional points. Part B is going up. This is almost another double-digit premium increase. It's a little less than 10%. One way for annuitants to save is to consider Medicare Part D. There's 20 FEHB plans that have a Part D plan. To get approval from OPM, they must provide equal to or better than coverage. That means that the formulary should still be providing you access to the same drugs, and that your out-of-pocket costs will be at worst the same. But in many cases, when I go and I use the prescription drug costing tools on the carrier websites, I'm actually seeing lower out-of-pocket costs from Part D. So depending upon your prescription drug needs, This could be a way to save money. And as Tammy mentioned, there is an out-of-pocket catastrophic limit with Part D, $2,100 a year per Medicare beneficiary. You will not have to pay any more than that for covered prescription drugs. So anyone who has high prescription drug costs, Part D could be a way to save some money next year. Now, if you have Medicare Part A or Parts A and B, and you're in one of the plans that offer Part D, you will be auto-enrolled. And I think that most people should take this unless you are subject to IRMA and have to pay that income-related monthly adjustment amount surcharge. If you don't have a lot of prescription drug needs, you can disenroll, and you'll never be subject to a Part D late enrollment penalty because every FEHB plan has what's considered credible prescription drug coverage. And if your situation changes in the future, you can come back to Part D if your situation changes and you have more prescription drug needs. Two other cases: if you live overseas, Part D is not going to be right for you because Medicare doesn't reimburse for purchases of drugs overseas. And then if you want to use both the Part D plan and a pharmaceutical discount coupon, you can't do both. So if the savings from pharmaceutical discount coupons are worth more to you than the potential benefits of Part D, then maybe disenroll from Part D. But for everyone else, I think Part D is a good choice. So in summary, even if you're not highly motivated to switch your health plan, there's homework every open season that I think everyone needs to do. You want to know how your premium has changed. You want to know if there's key benefits in your plan that have changed. Go to the plan brochure to find out more information on both. And then also, I think checking on your providers to make sure that they're still in network, and if there hasn't been any changes to how your plan covers prescription drugs. And so with that, I yield back the balance of my time, and thank you very much for having me today.
Thank you to our panelists for sharing this important information. We really appreciate your time and insights. And if you ever need help with a federal agency, please do not hesitate to contact Congressman Raskin's district office at 301-354-1000 or raskin.casework@mail.house.gov for assistance. Thank you.